Can you hear me?
Hey, good to see you.
Same here, man. Wow. I was reading some more of your stuff besides that one blog. Can you hear me? Hold on. Let me make sure this is going. Let me do just a quick intro. Um, how do you pronounce your last name? So I get it correct?
Alexandrov?
Okay. It's like,
Alexandrov?
and the BC Kim, right? That you have on there slash MBA. Can you explain it to me before I announce it? I'm gonna, 'cause we're gonna cut this part out and then I'll intro you.
Just just a chemist, bachelor's chemistry.
Okay, welcome to the Dan the Messenger podcast. It is actually December 1st, 2020. I have a special guest on with us. His name is Nikita Alexandrov. He is he has a bachelor in is it biochemistry? Is that
In chemistry.
Yep. And you have an MBA, so you're a pretty smart guy. And a mutual friend of ours from one of the research groups I've been in sent me a link on a subject for long haulers. And it isn't like the guys that we deal with are just Googlers. I fortunately got into a group by this luck of the draw. You have done it because it's part of your background. So to the audience, the reason why I brought on Mr. Nikita Alexandrov is not only you have a background in this, but you're a COVID survivor as well. Is that accurate in saying?
Yeah, that's right. I got really sick in February, late February, early March, when there wasn't really any testing going on.
So you have a vested interest in this as well as I do, correct? Like we both are trying to get to a solution of normal health to our bodies. First off, right? As that's a human instinct. We want to take care of ourselves.
Yeah,
Yeah.
that's right.
Yeah. So self-interest is there for both of us. So we're not trying to create something. We're trying to solve a problem to something. And that's something that you and I both seem to have in common. We're working within these groups from different perspectives, from different fields, from all over the planet. And it is amazing to see the technology working on with so many people at hand. I mean, I don't think without this technology we would have as much of an understanding as we do about this current pandemic virus on the back end of it,
Yeah.
right?
In the early days, it was all kind of through peer-to-peer technology. Like I remember there was just no information in January, February, March, and there was all these groups of frontline doctors and nurses. They were all on WhatsApp sharing information, and it was all kind of peer-to-peer in the early days. And to be honest, it hasn't gotten much more organized recently. It seems like the information's still really fragmented.
Yeah, I mean, I know that there's over 140 research groups that work across the globe. There's connected. You can see it. That one of the groups that I'm a part of, I can see the outline of the other groups, and it's definitely all hands on deck with this. The media has not done us any service or distant service by how they've covered this. They could have done a better job. Would you agree that's a fair assessment? Did you hear that, Nikita?
It just cut out for a second. Sorry, could you
Oh,
repeat that?
so what I'm saying is, you know, the media, how they have covered the virus, how they portrayed it. I call it talking out of both sides of their mouth, covering it different ways to confusing people to the point where a lot of Americans don't believe it's real. You know,
Right.
I mean, I know this. It's part of the thing I deal with on a daily basis, even to this day. But it's one of those things that this virus touches everybody. You know, part of what I say on my show is we all got 99 problems, and COVID seems to be number one, no matter how we look at it, from a personal perspective or a family member or a job. Or is that fair and sane? You know, from your assessment of what you've been dealing with.
Yeah, the media's made a mess out of it, and I don't know what's driving them. Maybe it's just whatever most sensational story is, some kind of script they like to stick to. It seems like whenever there's some kind of drama, they're always there. But when there's some kind of resolution or reconciliation or solutions, they're nowhere to be found and looking the other direction. So I'm not surprised there's so many Americans who don't believe COVID exists. I mean, because there are a lot of holes in the kind of story that you see on the news. I mean, there is absolutely people getting sick in a new way. Does it line up with the PCR testing results and the case numbers you just constantly hear about? I don't think so. I think we've increased testing a huge amount recently, and the case numbers, of course, went up when everybody has to get tested for work multiple times a week, et cetera. So I think there was a brutal first wave of the pandemic. The media managed to not catch any of that, just assumed all these people dying didn't correlate to increased case numbers. And then now that the deaths were reasonably flat for 6 months or so, the media only focused on the case numbers. I mean, it's been totally backward. I'm not surprised people don't trust the news and the general story. They're just not focused on the right things.
Yeah, and let's get your background quickly. You worked in a lab in Canada, correct? Hello?
Yeah, I was working on kind of an agro-tech company in Canada. We were looking at starting a new company with some scientists that worked on vaccine programs. So in the early days, I was hearing kind of a lot of his perspective and from his network of what people were saying about COVID in the scientific community. And I'd previously worked in biotechnology, molecular diagnostics, making these kind of portable blood tests and things like we're using now for the pandemic, similar to PCR, a little more advanced. So yeah, I had a good kind of understanding of these types of things, molecular diagnostics and biotechnology and drug development.
And so, it's like the Matrix. Once you take the red pill, you can't get out of the way of understanding the complexities of this virus. From your perspective in groups, does this act like what they say it's acting, like a predecessor of the coronavirus, or does it act more like another type of virus than what they're stating?
Yeah, it's really complicated. I mean, I don't know what they're really saying because every time you turn on the news, it seems like they find a new organ system it attacks. This seems to be the magic virus that does everything. Same with the publications. I mean, every kind of company with a cell model they've been working with or screening against that and making assumptions. Every company with a drug that could be used for antiviral effects or screen against their drugs and making assumptions. Every university with kind of a receptor screening program is doing their thing and making assumptions, and nobody's really stepped back and looked at the big picture. So that's one of the reasons that these private research groups and I think people like me are helpful because we're not tied to any one program, so we can step back and look at a lot of different research, call different researchers, ask big questions. And I think it's not the virus that attacks every part of the body. In fact, they don't find it very often in the tissues. All the complex effects there are, it's not really ever found in the tissues. They say it attacks the brain. They find neural inflammation in the brainstem, the frontal cortex, different areas, but no viral presence. So it's pretty clear that it's attacking something else, leading to these downstream effects. And we found a group that seems to have connected all the dots, and a lot of people are barking up this one tree. It seems the virus may somehow attack the energetic system of the body. It somehow depletes the NAD+, which causes dysfunction and kind of all the metabolically active organs like the brain, the heart, the kidneys. And then because there's this depleted NAD+ system, the body feeds in tryptophan to make up for it, and that depletes your serotonin. That leaves you with brain fog, with just feeling unwell in general. And then your mast cells, they activate to make up for that serotonin and release histamine, and then you end up with all of POTS and dysautonomia, inflammation, and it just constantly evolves because it's a highly coupled cycle. So I don't think it's this mysterious virus nobody can get a grip on. I think it's just attacking such a low-level system. We have to step back and look at those deeper mechanisms.
And you have a quote, and I'm a fan of this myself, and I've mentioned it many times. If you know thy enemy and know yourself, you need not to fear the result of 100 battles. And that's Sun Tzu's Art of War. And so we already know our bodies. It's how we are looking through westernized medicine that is affecting a lot of our outcomes. And this seems to be a whole new ball of wax when it comes to the virus. Now, you were telling me that what's funny to me is the more I see some of the side effects or the known issues, and I line it up to another virus, more like a retrovirus, and you see the mention of peptides. I've seen the mention of peptides in this thing so many times. I'm like, I've heard this peptides talk before, and it went back to the 80s. And I'm wondering if there's any correlation, because I know I've got a few papers myself from a HIV specialist who does walk the path down line of these viruses are mimicking each other in similar ways. Is that an outlook for you that makes a little sense too from some of the things you've seen, or is that way off the spectrum here?
Yeah, so in terms of comparing it to HIV, it seems like there is some kind of dormancy mechanisms in SARS-CoV-2. You know, there was a lot of speculation if it looked like there was some gain of function that looks similar to HIV and SARS-CoV-2. I don't think there's scientific consensus on that, but what people see out in the field, it does mimic HIV in some aspects. It seems to dampen the immune system. A lot of secondary infections in China. They were seeing 50% of the people in the early days were suffering from secondary infections in the hospital. I think that's a really under-researched area in the US. They don't focus on the fact that this thing can open the door to bacterial infections, sepsis, as you mentioned. You've heard a lot of kind of people suffering from sepsis. It seems to wake up dormant neurotrophic viruses like HHV6, Epstein-Barr, which something like 95% of us have. There's been a lot of clinical data around reactivation. So in terms of secondary infections, it does seem very similar. And interestingly, 9 out of 10 people that died of COVID had vitamin D deficiencies. You can see the same type of thing in HIV patients. Very often HIV patients have depleted vitamin D. So really like a lot of similar parallels. And I think that just goes to the core issue that we don't fully understand our bodies and don't fully understand viruses. We haven't quite stepped back and drawn the line around, what's similar between all these things. And we obviously haven't figured out HIV yet. So I think we still have a lot to learn.
Now, yeah, exactly. And you and I have rubbed elbows with pharmaceutical companies. I've worked for one. They won't take my calls, they say, and I say jokingly half the time our show is sponsored by Pfizer, because I've been just laying out their playbook of some of the things they do. And I'm not anti pharmaceuticals by any stretch of imagination, but anybody that I deal with on a professional level that is in your industry, every one of them says, hell no, 7 days a week and twice on Sunday, would they take any of these vaccines right now? There's not enough data or science behind it. Is that a fair assessment from your perspective, from your colleagues that have been looking at these vaccines?
Yeah, I think it's just been kind of science by press release. I mean, we're making national vaccination policy based on the press releases of some pharmaceutical companies. They have half of their budget for PR and they know how to make a sexy story. I think there's still fundamental questions that are unanswered that are scaring me. I mean, our tests don't work properly, so what policy for vaccinating people who suspected have COVID, who have long COVID, who might have come into contact with it? We need to make sure that's documented and probably avoided. You know, you don't want, vaccines are made for healthy people. If you give somebody a vaccine with a tampered immune system, you don't know what's going to happen. That's why we never deployed a SARS vaccine. There was immunological events, people spontaneously having really negative outcomes. And then, you know, there's been a number of adverse events in some of the trials. They had some cases, I believe 2 cases of transverse myelitis. They just struck that and said it's unrelated, but in the clinical literature, transverse myelitis, you know, basically MS, has been seen with people suffering from coronavirus, and it's actually been seen with the adenovirus vector they're using in those studies. So it just seems like it's been a little bit lax, and it seems like anytime there's an adverse event, it happens to be unrelated, and we just don't know enough about COVID or long COVID or any of this stuff to say that understand it enough to make a vaccine, I believe.
Now, what I advocate is getting long haulers, you know, getting some of us, ones like me, that have a pretty good understanding of our bodies and what's going on, not into research groups per se, like for vaccine trials, but for research groups to help understand what's going on. And there's nothing like that right now. You know, the groups that are out there are Facebook groups. That's it. You know, these poor people, I'm going in there and I'm putting videos in daily, trying to give them information to keep them alive. That's, you know, that's what I've been doing. I said, listen, I'm the Ron Woodruff of our era, except I'm not trying to do a Dallas Buyers Club. All I'm trying to do is get generic medications that are known out there that can be therapeutics that can keep people alive and thriving and get through this. And the longer that you do not get a treatment and you have this thing rocking and rolling inside your body, well, the more damage it can cause. Now, that's pretty accepted across your colleagues. Early treatment protocols are the most essential in beating this down. Is that fair? Is that an accurate assessment?
Yeah, absolutely. You got to take care of it early, and we don't know what happens to long haulers in the long run. I mean, based on the theory, I think is the most relevant and seems to be helping people. It's not a good thing to have these unbalances in your body in the long run. You're going to be at risk of other disease states, and you know, you're seeing it already. People with long-term kind of long COVID issues suffering for months. You're starting to see strange things like teeth falling out spontaneously and a lot of really creepy side effects, which I believe are, you know, I personally believe are a symptom of energy depletion, NAD plus depletion in the long run. That about the researchers, yeah, it really is the patient advocates standing up and answering questions for themselves and educating their doctors. The doctors don't even know what traditional biomarkers are used for long COVID. You go in there, I've heard the story like 1,000 times. They do some basic blood tests. They count your blood, red cells, white cells, and they say, you know, you're fine. We can't find anything. You have anxiety. But now there's one group I'm impressed with. I believe the company's InCell DX. They found a panel of biomarkers which they say can predict long COVID with 97% accuracy. So I think they found a diagnostic test for long COVID. They're doing research in the States, trying to get their test approved. So they believe it's the cytokine biomarkers, which you'll find elevated in 97% of the cases. So IL-2, IL-10, IL-6, I believe, a few others, InCell DX, you know, they actually can do testing for you as part of the research under kind of a research caveat. So if any long haulers want to get validation that they are in fact having dysfunction in their body, reach out to them. Their test isn't fully approved yet, but as part of their research program, I believe they can give you those cytokine biomarkers, and it makes a lot of sense what they're seeing in the context of the theory that I think is most relevant.
Okay, so Nikita Alexandrov, we're going to take a quick break. You have a bachelor in chemistry, an MBA, super smart guy. You've been on the front lines with this, with other frontline workers and researchers trying to wrap your minds around this. You do have some good news. Something that they're finding that seems to be working. So when we come back, we're going to talk about that on the Dan the Messenger podcast. Brought to you by hopeforhumanity2020.com. Hope number 4 humanity2020.com. Welcome back to the Dan the Messenger podcast. I am here with Nikita Alexandrov. You are based out of Canada. Is that accurate? Correct in saying? Nikita?
I was living in Vancouver. I came to Australia to. Can you hear me all right?
Yeah, I can hear you. Go ahead. I can hear you.
Yeah, I was based out of Vancouver. I'm living in Brisbane right now. I got stuck here in Australia during the lockdown. I was on the last flight out, and I just extended my visa, and I'm relaxing in Australia while the world turns.
Okay, so how we connected was through one of our groups. Mutual person introduced us. You had the paper talking about long hauler cracking the code possibility. Now, meaning that there is a chance that long haulers could start taking some medications or stuff you can get in your pharmacy that can actually help with this. Is that correct?
Yeah, the doctors that kind of developed this theory, this grand unified theory of COVID, which I respect a lot. I've looked into, and it seems to be echoed by all of the research. I haven't found any flaws in it. They believe that they found a treatment, low-cost treatment for long haulers. They've administered it to maybe 50 patients, kind of on an ad hoc basis, and monitored them. Seems like everybody has had pretty dramatic improvements, a lot of full recoveries. Anecdotally, just sharing this information in my network and seeing the grapevine of the general long COVID network, it seems like a lot of people are getting huge benefits from this method. So they believe that you can support the NAD plus system that's depleted by taking nicotinic acid, which is niacin or vitamin B3. There's a lot of versions of it. There's no flush versions. I wouldn't recommend those. The time release versions burn liver, nicotinamide, and nicotinamide riboside. A lot of these other NAD plus supporting compounds, they don't seem as effective. It seems there's one proper entry point into the cycle for a number of reasons, and that's the lowest cost, most available nicotinic acid. So yeah, they're seeing you supplement with nicotinic acid, you use some cofactors for NAD plus synthesis in case you're deficient. So things like vitamin C, vitamin D, zinc, selenium, quercetin, and quercetin actually acts as a mast cell stabilizer, so you can reduce inflammation in the early stages with that. But yeah, they're seeing really impressive results anecdotally. I'm just a researcher. I can't give medical advice, and people need to be careful because nicotinic acid causes a flush, but it seems like in a lot of cases, within a week or so, the kind of low serotonin, brain fog, some of the neurological effects go down. You'll have some of the body aches and pains within a month or so dissipate. Sometimes they've seen it takes longer for people that have serious low-level issues with the metabolism of their heart, etc. So they've seen people, require 6 months of this to get totally back to normal. But it seems like there's a number of reasons nicotinic acid would be a really smart choice for long haulers, including some really forward-looking research that's in print that nicotinic acid may almost as a bioenergetic pump. It can help pump inflammatory compounds out of your cells. There's been some publications in Nature saying that nicotinic acid's a good bet. There's some publications showing that it might be beneficial in lung damage. I mean, really, there's probably more evidence for nicotinic acid than a lot of other things. You know, you see vitamin D deficiencies correlated with death, but vitamin D might not be the thing to help long haulers or after you've already had an issue. Vitamin C obviously makes a lot of sense, and that makes sense across all aspects of COVID, but it doesn't seem to address the core mechanism, only kind of support. So yes, what we're seeing is really, really amazing results with nicotinic acid. A lot of long haulers are kind of taking on themselves to experiment and try different supplements and are keeping track of working and sharing data across these groups. It's a really good community for positive results, and you're starting to see a lot of doctors and researchers kind of barking up this tree and asking questions about it. So I'm really hopeful for this therapy. There's another doctor, I can't remember her name, she deals with mast cell activation. I'll send you a reference. And she also uses this exact same stack for mast cell activation syndrome before COVID, and she repurposes it for COVID patients. So a number of doctors are actually using this mechanism, using this stack of compounds to hit this mechanism, maybe not totally understanding how it applies to COVID, but just seeing that it works. So it's a really exciting time. There's finally, you know, some emerging biomarkers. There seem to be some emerging natural solutions, and it's really changed a lot since the early days when everybody was confused and the media and general academic consensus was, you know, this was psychological.
Oh yeah, and
we've really rounded the corner.
Yeah, you know, as a long hauler myself, someone has been in the hospital, I think 7 times since March. You know, I dealt with the treated like alien to being asked about as a drug addict to be, you know, inhumanely treated to the last time they sat down and they were writing as fast as I could talk to them. The information I was giving to them, they were just shocked that I knew more than they knew. And I'm like, I'll send you anything you want. I don't want to, my whole goal with the Dan the Messenger podcast with Hope for Humanity is A, to get through this pandemic. B, I lost a friend of mine. And C is to try to save one person a day. If I could just give enough education to one person a day, that's my goal. Because you know as well as I do in these groups, people are in there by the thousands of, not hundreds of thousands, and they are scared. I had a young man the other day said he was never felt this way in his life and was looking to commit suicide. Direct message me, and you know, these are things I was not prepared for as a long hauler. I knew I was going to be an advocate. I knew I had enough of a brain and background to help and a voice that could make sense out of the senselessness. But having people like you on, Nikita, is a blessing, because long haulers are going to be going, what did he just say? You know, what's NAD? What's the, I mean, they're going to start looking it up. And I always encourage people to talk to your doctors, because I'm not a doctor. I don't play one on TV. I'm a long hauler. Everything that I do is through my doctors. I happen to have 2 really good doctors. Dr. Hume is my primary, and then Dr. George Roselle, who's a senior fellow, is the one who monitors and does my brain treatment for QEEG therapy. You're very familiar with that, or you understand it a little bit, QEEG? And he's a senior fellow, so that means he's got a little bit of time in that field. That's a big deal to be that, isn't it? Nikita, I'm asking you that, you know, having that senior. Go ahead.
Yeah, that's and like what you said about the doctors, you know, they'll be the ones putting things down, because, you know, doctors, the way the medicine protects itself is it tries to avoid quackery and avoid false promises, and so it's a very slow process to change, whereas the kind of research segment and people that kind of ask big questions like me and other informal researchers, they're willing to move in a lot of directions. So I think now you're finally starting to see doctors like you mentioned, and doctors on the front lines in general, they're realizing there's this kind of feedback with the researchers, and they should be following the new publications, even though there's so many, it's hard to keep up. I think it's important, like you said, to make that link and help educate the doctors, help connect them to new research, to new groups, because doctors, frankly, just don't have enough time to educate themselves with everything going on. So it's really up to the patient advocates like you to close that loop. And it's a really, really important thing you're doing.
It's a labor of love because there's no reward. Blood, sweat, and tears is all you get from it, and a lot of fighting, a lot of infighting, a lot of blackballing. I've been blackballed from the media. They won't have me on any show. I promise you, because I'm not the long hauler they want. I'm not the victim they want. I don't fit their narrative, but they know about me. And pharmaceutical companies know about us too, because they've sent us cease and desist and a few other things. So we're doing something right, but we're not trying to do it in the wrong way. We're trying to really just give you information to help everybody through these times. And having someone like you is like I said, I'm humble that you came on, and I, we'll talk this a little bit more. But I've told you about a tour we're going to be doing in March of next year. It's a 14-city tour, and the name of our charity is Hope Number 4 Humanity 2020.com info and org. And our whole goal is to call it the Hope for Humanity 2020 Survivors Tour. And it sounds, a little odd saying that, but we've known this for 6 months that we were going to do this Survivors Tour. Well, how in the hell did I know this? Well, because I've been in your guys' groups, and I've been a person who's seen the data and the numbers. And there is one of those situations where, am I really in this, or is this a nightmare? Because data and researchers have a very dry sense to them on when they're dealing with these issues. And I will hear statistics, or I'll see the data, and my eyeballs will start popping up because I understand it, but they're very, specific to what they're trying to accomplish. So the Hope for Humanity Tour is to try to get out there, communicate with physicians, frontline workers, EMS, our mayor system, our community systems, and to hit these cities to see how it's affecting us in March. It's going to be documented, and it's going to be released. My story's been documented since day one, which is a good thing for me, because we can break the timeline. You know this, and I know this. The timeline's way off, way off. The narrative of when it came out is not the truth. It just isn't. That you can follow the data. And that's what a few of our detectives are doing. They're following the data. And we're going to find some connections here quicker than later. And they know this, right? I mean, the data is the data. It's out there. Am I off in saying that the timeline in your eyes and our community that we're involved in, that say this timeline is not the one that's being put out there? Is that conspiracy talk?
Yeah, I mean, if you talk to long haulers, so many of them got sick with textbook COVID, December, January, before they say it was really widespread. Some studies of the wet market in Wuhan, between US scientists, European scientists, indicated that wasn't ground zero. That was just a super spreading event. It's been promoted today, a lot of news saying they found it in the US in December of this year. They found it in Italy. They found apparently Italian blood sample months before that. So it keeps popping up all over the world. The World Health Organization is now traveling to Italy, and they're just now starting to investigate the blood samples that they found in blood banks in Italy, showing it was there months and months before. But just knowing long haulers and hearing humans' experiences around the world, people all over the world were getting symptoms which seemed to be misdiagnosed COVID long before Wuhan.
When we, what I say to that is not a conspiracy theory portion of it. It's more of, you need to have accurate data in order to get the timeline down. If you can get the timeline down, you can follow the pathology of this. You can follow the pathology of this. You can start seeing a pattern. When you're putting the wrong narrative, the timeline, well, you're messing with researchers that are trying to, look at the whole playing field and get the data accurately. Now, I go to a movie that is beyond me, that no one talks about it. When they first came out, pandemic, Was it the movie Pandemic? I can't even remember the name of it now. Gwyneth Paltrow. There was a movie that came out like 6-7 years ago that mimicked what's going on. But the real movie that catches my eyes is And the Band Played On. You ever seen that movie? Nikita, have you ever seen the movie And the Band Played On?
I haven't, no.
Well, watch it. Based off true story. CDC, I think it was an epidemiologist, or I think it was epidemiologist, Dr. Don Francis. He was one of the doctors that found and went to the Ebola site in the 76. And he was part of the Gallo Institute and the Pasteur Institute's hunting down and basically finding the first retrovirus. It took them 6 years, 6 years, I think, from 78 was the first case in France to 84 before they got the first testing available for it. But something that's not being talked about very much that I am very curious about is the blood supply. If we don't have a test that's accurately detecting this and people are donating blood, what's going on with their blood supplies right now? Because that was a very similar issue with hemophiliacs back in the 80s. These are honest discussions that need to be had. If we're going to talk about it, I've seen some of your things saying, well, let's talk about it. Let's get real. Let's call this for what it is, and let's get the science down and battle it. That's an honest opinion, right? If I'm looking at it, I'd look at the bloodline right now and make sure our blood supply is not causing some other issues.
That's right. Yeah, our testing doesn't seem to be very accurate. In China in the early days, they were saying they were doing 2 PCR swabs 2 days apart on their patients. They were doing cold storage supply chains for those swabs, so much higher quality than we do in the States. And even with that, and they would test all swabs within 2 hours in cold storage. They were getting 30% false negatives, so they would do next generation sequencing and anal swabbing PCR tests before they would rule out COVID. Whereas in the US, you just do one of these rapid swab tests. It says you're negative. It's like, oh, all good to go to work. But the amount of people I've talked to had textbook COVID, tested negative, and just said, well, that's fine. I can just go back to work and go back in my community. I mean, it's just crazy putting too much trust in these PCR tests. They were made as an indicator, not to diagnose people. You can see the inventor of PCR, Kerry Mullis, he was a big advocate saying this was for manufacturing, like this wasn't supposed to be a diagnostic tool. So I think we're too much on the PCR tests, and we should be diagnosing based on symptoms and these new biomarkers we have. And, there was the story today, Ryan Sutter, the celebrity Ryan Sutter. It says Ryan Sutter details his symptoms amid struggles with a mystery illness. He had something which looked like textbook COVID filming in February. Since then, he's been chronically ill with what looks like long COVID.
Oh, Ryan Seacrest? Are you saying Ryan Seacrest?
Ryan Sutter, the celebrity, he had something like 5 COVID tests in a row, and they all came up negative. And so now the media is saying it's this mystery illness, and he's being tested for cancer. And I think we just need to be aware that these PCR tests are not something to lean research on, and they're not the gold standard. In fact, they've never been standardized. So we have to be careful when we only look at testing and case numbers, and you have to use your best judgment, your best sense. If you have COVID symptoms but a negative result, maybe you should talk to another doctor. You should see if you should quarantine. It doesn't make sense to treat this as a gold standard. These tests are very unreliable.
Now, I was in a group, and there was a epidemiologist, virologist. They got up, and one of them said there was over 30 known strains that they knew of at the time. And the tests that we're talking about right now basically tests for 3 of those antigens. Is that correct? The fast rapid test. And so if you're only testing 3 out of 30,
that's right,
your accuracy level is going to be pretty off. And now the CDC just released a statement a couple of days ago stating that it's probably 8 times more cases and they predict it. So if it's times 12 million, 13 million, times that by 8. And then they say you can double that because there's another percentage of unreported. So they're coming up the number of around 100 million of Americans have contacted or contracted the COVID virus currently. I've been saying since March that the train's already left the building. 15 days to slow the spread, 30 days to slow the spread. Now it's been months and months and months, and they're calling it waves. But is it more that maybe these people have been infected? It's been in their blood, and now it's starting to activate. The mild symptoms hit them. Now they're getting to a different stage of it. And now they're getting sick. That kind of make more of an ideal for the pathology of how this thing can activate, not just instantly, oh, you're sick and you're on the ground dying.
I think so, yeah. I mean, if you look at March, it was just a huge peak of deaths. We didn't have testing back then, so we can't actually say how many people were infected. But I remember reading one research report saying there was something like 5 million anomalous fevers 1 month at the beginning of the pandemic. I think it's a lot more widespread than we believe. And I think a lot of people are seeing that they maybe got it asymptomatically, mostly asymptomatically. Some months go by and the symptoms pop up again. I think that's a reactivation. There were some studies that showed through genetic sequencing, it looked like there was a reinfection. I believe that study was a patient maybe going through chemotherapy, or there was some confounding factors in the one of the reinfection publications I've seen. I think it's definitely a case of reactivation, or even just a reactivation of symptoms. It might not even be a viral reemergence. It could be that you're getting secondary infections or NAD plus deficiency causing secondary issues. Because if you look at Davari, it's outside of Mumbai, the Indian slums. They had something like 6% of their people had antibodies. It had just tore through there because they have communal bathrooms. There's millions of people in a few square mile area. And, if there was real reinfection with just the size of India and people moving in and out, everybody would have been infected multiple times in there. But it seems like Davari has hit some type of herd immunity. They were at 60% antibody equivalence. They're pretty much there. Maybe some of the antibodies wore off. And you have to remember, antibodies aren't the only way to get immunity. There's this innate immunity, which can last decades. And it seems like it's a lot of scientists are forgetting that you can have immunity to something without expressing antibodies. So this year has just become very political and science through publication. But if you look at what's happening on the ground, it seems a lot more like this type of activation, secondary infection reactivation. And I don't see any evidence that you can be infected multiple times, or at least that it's very common, because otherwise there's a lot of places on Earth that would be just people dying in the streets if that was the case.
Now, that's good news. Good news, bad news scenario. The contagion factors out there.
It should be on the front page of every newspaper.
Yeah, it's not like we're going doom and gloom. The world's ending. I say this: the world is not ending. It's a shift. We're now post COVID-19, and we're going to handle things a lot differently. But the way our politicians are reacting, it's a knee-jerk sensation. They need to start listening to patients like us. Long haulers that know what the hell they're talking about, that have been studying and working. And we're not experts, but we sure as hell know our bodies. So we can be advocates. And that's why I tell all long haulers that reach out to me, be your own advocate. The doctor sent me home. Go get another doctor. I'm amazed that they are still sending people home that test positive and not doing any early treatments. I'm like, what in the actual fuck just happened? So I have to say, you have to be your own advocate, guys. The information's out there. The documents are out there. The medical documents are out there on .gov medical research websites that are publicly available. Generic medications are treatment protocols. Now, you and I both understand to get to generic, Nikita, it takes a little while. That basically is like losing your patent, and then anybody can make your drug. And there's no money in generics because you can't charge that high dollar rate. So it's easier. So we know that if you follow the money, that's one of the problems with this. Big Pharma's got their hands all over this, and they're watering at the mouth throughout this new RNA vaccine that not a single group that I'm involved in, I'm not talking about long haulers. I'm talking about the epidemiologists, the virologists, the frontline workers are even close to saying, yeah, we think this is going to be it. Never in this history of our planet have we developed something like this or used it on human beings. Is that accurate? Is that a fair statement?
Yeah, that's totally fair. I mean, we've never deployed an mRNA vaccine, and really, we've never deployed a vaccine for a pathogen this novel at this scale before. I mean, we have clinical trials of 20,000 people that are supposed to represent the genetic diversity of the entire globe. I just don't think that's reasonable. I don't think it's wrong to just ask these basic scientific about the safety and how fast has been developed, the new technologies being used. It's become a bit of a naughty thing to ask questions or question any aspect of this vaccine rollout. But I think especially for people that are long haulers and have compromised immune systems, they should definitely be asking questions, talking to their doctors, trying to keep up to date with what's going on, because it makes no sense to deploy a vaccine to a population where you don't even know who's infected and who's not to any degree of accuracy.
So, I can tell you that most researchers are not anti-vaxxers, meaning that they're not against it. They're just, there's no data. There's not enough data, and that's what they follow. They follow the science. They don't follow a newspaper article or I wouldn't say propaganda. I would say a very well produced point of view on a news outlet that is not accurately news. It's just their perspective. And I think that's one of the biggest things in American news that's been lost, is a lot of this is their perspectives now. It's not just stat, cut and dry, and this is the way it was. This is their perspectives. They know how to bring the right people on to give you the perspective they want. They don't bring on the people that they don't. There's a group out there that you and I have become fans of called Survivors Corp. And early on, they looked like they were the good guys. And then I started noticing, one of their ambassadors was provided by a group called COVIDx Now. And then I followed the money of COVIDx Now, and lo and behold, Pfizer was right there. And so we've called them out. We call them the evil empire, because they've been using long haulers as ambassadors that don't know very much about science, and they're using them as puppets. So people like you and me, I've been banned from the group. A couple other long haulers that started talking to them about drugs and medications, they banned them as well. What was your problem with Survivor Corp? Because I'm burying them as far as I possibly can, because they are not a part of the solution. They are a part of the problem, because they're not taking it from a scientific approach. They're taking it from big pharma approach or a certain agenda. And that's not what we're trying to do here. We're trying to get to the solution to this problem. So what was your issue with Survivor Corp? Just so I know, because you're not the only one.
Yeah, a lot of the groups, they seem to, have a lot of reporter contacts, or they seem to be working with commercial companies informally. That's fine, but I don't know. I share a lot of research and blog posts, and people always think like, oh, this guy's talking about this or that. He's trying to sell something. So it's probably something to do with that. But most of the groups, like people sharing ideas and research. But I noticed pretty quickly, I think I was banned from that one. And in general, you're going to see this a lot. There's this group, I believe even the World Economic Forum's doing it. They're hiring media influencers to, they say, prevent misinformation. So there's, hundreds of thousands of people they're hiring as social media influencers to prevent vaccine misinformation, is what they're promoting. So you're going to see a lot of these kind of social networks and groups like this have commercial interests behind them, as people are trying to prevent misinformation and whatever they say they're doing. You're noticing basically social media influencers in a medical field being weaponized for political or commercial purposes. So, you might have noticed it now a bit with these groups you're talking about, but they're formally hiring hundreds of thousands of social media influencers very openly to stop misinformation. And the risk is, they call it misinformation, but at some point, anybody posting something on YouTube that went against the World Health Organization was considered misinformation. So at some point in February, if you said COVID spreads person to person, you know, that contradicts WHO, you would have been guilty of misinformation. I think it's just dangerous to for companies and stakeholders, you know, nonprofits, whoever is behind these social media campaigns, to say what's the facts and what's not, because even in the scientific consensus, it's, like I said, science by peer review, and nobody has the facts. If somebody has the facts, they haven't given me the facts, because I've searched really hard for data-driven facts, and yeah, I think we're going to see a lot of what you're talking about, and it's going to be a new paradigm where, you know, you go online and you're asking questions about your health or stating your opinions, and all of a sudden you have people who are paid influencers who have their own thoughts. And I think it's kind of moving in a very strange and dangerous direction where companies and influencers who don't really know what they're doing are trying to control the narrative in a certain direction, even if they're doing it for a good reason to prevent misinformation. The point is, nobody really knows what the facts are and what's not. Everything changes so fast. Nobody has the answers. You just have to use your best judgment. And these kind of social influencers campaigns, they prevent you from using your best judgment. They try to give you the answers. And yeah, I guess the point is, don't trust anybody who says they have all the answers.
And you know, I say I'm like the Forrest Gump of this world, because I get around some of the weirdest people. Not weird in a sense, but never in a million years would I've run into you. I was in the solar industry at this point. I walked away from pharmaceutical in 2012, 2013. So, but I'm getting to meet an amazing group of people through this. And as we do the documentary, Nikita, I would love to have you a part of it. It's an open invite. You are way above my pay grade when it comes to your knowledge base. And I think it'd be great as a long hauler to have as many different perspectives as I can with data-driven material, that when this comes out, they can use this, you know, they can, there was a thing, an article came out on fake news, and not an article, but documentary. And they were saying, you know, well, at least, you know, it's fake news in the sense that at least you're objective about it. All right. But when you are purposefully taking down one side or the other and only pushing one narrative and then saying it's fake news, well, that's not really the truth. And we're smart enough human beings that we can use that little Google device and kind of look up these details for ourselves. So that's what I try to pitch the show. I say, listen, come on. I have no objective other than to listen to your perspectives, my perspective, point of view, hear what you have to say, and let you talk. Because we stop talking to each other and we start talking at each other. Until we stop that and get back to having a two-way conversation, three-way conversation, get more brain power together, look at the football field differently from different, you know, because Sun Tzu's Art of War. Any military worth its salt gives their officers Sun Tzu's Art of War to study. I've read it multiple times. And it isn't just for battlefields, it's a strategy. And those strategies through time have been effective. And this is where I have a fear that the military is going to be taken over here eventually if the civilian side doesn't get their shit together, allowing this to progress. You know, America's been going through a lot. And I'm trying to help heal. And that's what I want to do the tour for, is to go help talk to other long haulers, stop making them lepers. This is the other part. I had a sheriff jump 20 feet from me when I told him I was a long hauler. I kid you not. I'm like, I'm not contagious. I haven't been for many, many months. It's in my sealed circulatory blood system. If anything, it's not going anywhere. It's like having cancer. I'm sorry I have cancer, but there ain't nothing else I can do about it. And I say, stop gaslighting these long haulers. Start treating them with empathy and understand that this is something that we are all going through one way or the other. So if it isn't the patient perspective, it's the nurse, the doctor losing their mind, meaning they're dealing with this on a level that no one's ever trained for at the moment, not since the 1918 outbreak that, you know, the medical industry sees something like this. Would you be willing to be a part of the documentary? And it's a serious question, because I respect what you have to say.
Yeah, I'd love to help promote kind of solutions and shed light on this situation however I can. I don't have all the answers, but I've read a lot of research and I have chased a lot of groups working and spoke with a lot of researchers. I have a good grasp on the situation. I'd be happy to help.
Yeah, and you know, that's been my hardest problem, is getting people out of my groups to come on, because I respect their privacy, first of all, and second of all, it is a very political environment, and if you are saying against someone's narrative, they're going to come after you. It just happens. So, Nikita, we've been on this for an hour. I thank you very much for your time. Let's cover just one more time on the long hauler positive information that we are coming across. You were saying that in the front lines in Africa that they were using this protocol that you're talking about. Can you break it down one more time, kind of like over a couple minute period?
In South Africa, a group of biohackers and doctors made this hypothesis. They know what's going on. It seems like the virus is depleting the NAD plus, and that happens due to oxidative damage or a number of other issues. That's a common thing, but it's being depleted so much that your tryptophan is being fed into that cycle to make up for it. So you can't make enough circulatory serotonin. Your mast cells activate to release serotonin. It causes inflammation. It's just this long cascade of events. And therefore, with this NAD plus depleted, your metabolically active tissues like your brain and your heart don't have enough energy. But the good news is that's really easy to correct. Nicotinic acid, known as niacin, can be used to support that system. That's something anybody can get over the counter. They should talk to their doctors about that. It's very safe. You know, if you have cardiac issues, circulatory issues, you're prone to strokes, you might want to avoid anything which causes any circulatory system. But, you know, people are having success with that. I've yet to meet many people who've taken it consistently and haven't got really good results. So you can search this kind of NAD plus and COVID, or COVID and nicotinic acid. There's a lot of discussions online on the recovery groups, on Reddit. It's really, it's kind of getting out there. People are, you know, I'm seeing miracles, basically, people recovering. I'm just a researcher, not a doctor, but I can say, like, with friends and people in my network, it's definitely changed their life, and it all makes sense with this one mechanism. So especially those at high risk of this NAD plus deficiency, you know, they might not eat the best foods, they might have this subclinical vitamin B3 deficiency, or maybe you're an athlete or a runner. So you always have depleted NAD plus. When you were sick, it really triggered that. A number of long haulers or endurance runners or athletes, you know, if you're losing hair, that's a symptom of this vitamin B3 deficiency, pellagra. So yeah, especially if you're in one of those categories, you should talk to your doctor about supplementing nicotinic acid, and it really might surprise you. It's really good news. There's some kind of validations of the NAD plus mechanism. We're hoping that a lot more studies are forthcoming, and I'll do whatever I can to support research in that area. And there's some good publications. I've collected a lot of them on my blog. It's called The Team of Doctors and Biohackers Who Seem to Have Solve Long COVID. You can just Google NAD plus COVID and find a blog. A lot of good references there, a lot of good academic literature, but the proof is in the pudding, and people seem to be getting better spontaneously by taking a simple compound and supporting their NAD plus system.
So that is the good news out of this entire thing, is this is showing promise. It does have some good science behind it. And, you know, you guys are very humble when you keep saying you're just researchers. Well, you're not just a researcher. You have a bachelor's in your field. And it's like inventors. Well, if we didn't have inventors, we wouldn't have new things. Inventors are constantly looking into the devils in the details. And same thing for doctors and nurses. The doctor is overseeing the patient, but the nurse is doing more hand in hand with the patient. They're getting more of the information for the doctor. And you're doing that on a you know,
Right.
a data-driven level, which is vital to nailing this thing down. So don't underestimate the power of the researchers by any stretch of imagination. These guys eat, sleep, and drink this. And if it wasn't for you guys, a lot of things would never have been cured. or managed or treatable. So I thank you for coming on, and we'll be in touch. I've already talked to Dr. Rozelle about you. He's interested in maybe helping with, because you've helped raise monies. He's trying to do a research of 30 long haulers with brain based QEEG mapping and treatment protocols that he already uses. He would like to talk to you. And so I'm like, I'll introduce you via email, and you'll love him. George is an amazing guy. I've got a few.
Yeah, what he's doing is it's really important. The kind of EEG scans, they're seeing people's brains slowing down, firing for no reason. That's research that really needs to be done. This kind of observational research.
So we can definitely use your help in that area. That's part of Hope for Humanity's goal, is to get some data out there to help long haulers get through this. And so again, thank you very much. It was a little bit long-winded of an interview. Some of it might have gone over a lot of the listeners, but it's all Googleable. It's all, just easily stuff that you can follow, or go to my website. Go to hopeforhumanity2020.com, danthemessenger2020.com. Dan the Messenger, the podcast is available worldwide. We are featured on the podcast playground, and Nikita, I'm going to have you on again. When something else pops up, I'm going to reach out to you and ask you for some help, if you don't mind.
Sure. Keep up the good fight.
Hey, I'm trying. I try, brother. Hey, thank you very much. And
guys, talk about science whenever. Keep up the good work.
Well, I get these emails daily, and direct message. And the last one I got was from a lady saying, "Why wasn't I on Twitter?" And because she says my voice needs to be on Twitter. I'm like, I can barely operate the simple things that we are doing, because I'm older, I'm dealing with this, and I have a lot of the underlying issues that are known for long haulers. So I'm fighting a bunch of battles. This with my accident, my TBI, and everything else. So I try, and I'm just humbled that somebody's either dumb enough or smart enough to jump on and listen to us for a little bit and go, oh, these guys actually, they're onto something, and they're not trying to put a narrative. They're just trying to give information. So Nikita Alexandrov, thank you very much for coming in from Australia. 8-hour difference. So it's your daytime's our nighttime. We'll have you on again. Thank you for tuning into the Dan the Messenger podcast. Look forward to you guys coming back again and more, and we'll get to you more advice. Thank you very much. Nikita?
Thank you so